Want to pass your Hesi MedSurg exam? Then let's get started. Today we'll cover 10 questions based on Alzheimer's and dementia. Question 1. A 75-year-old patient with Alzheimer's disease is admitted to the hospital. Which intervention should a nurse include in the plan of care to promote the patient's safety? Keep the patient sedated, use restraints as needed, maintain a consistent daily routine, allow the patient to wander freely in a safe area. Pause the video and select your answer. If you chose option C, you are correct. Maintain a consistent daily routine. Consistency in the daily routine helps reduce confusion and anxiety in patients with Alzheimer's disease, thereby promoting safety. Question 2. The nurse is providing care for a patient with moderate stage Alzheimer's disease. The patient's spouse expresses frustration about the patient's repetitive questions. What is the most appropriate response by the nurse? Ignore the questions to discourage the behavior. Try to distract the patient with another activity. Provide a detailed explanation each time the question is asked. Tell the patient that the question has already been answered. Pause the video and select your answer. If you chose option B, you are correct. Try to distract the patient with another activity. Distraction can redirect the patient's attention and reduce repetitive questioning, which can be less frustrating for both the patient and the caregiver. Question 3. Which of the following is a priority nursing diagnosis for a patient with late stage Alzheimer's disease? Impaired memory, risk for injury, self care deficit, impaired verbal communication. Pause the video and select your answer. If you chose option B, you are correct. Risk for injury. In late stage Alzheimer's disease, the risk for injury is high due to impaired mobility, judgment, and coordination. Question 4. A patient with Alzheimer's disease is prescribed donepezil or Aricept. The nurse knows that the primary purpose of this medication is to cure the disease, improve cognitive function, control behavioral symptoms, treat depression. Pause the video and select your answer. If you chose option B, you are correct. Improve cognitive function. Donepezil is used to improve cognitive function by increasing acetylcholine levels in the brain, which can help with memory and thinking. Question 5. Which of the following should a nurse teach the family of a patient with Alzheimer's disease to minimize the risk of wandering? Use nightlights throughout the house, install secure locks on doors, avoid physical exercise, allow the patient to nap frequently during the day. Pause the video and select your answer. If you chose option B, you are correct. Install secure locks on doors. Secure locks on doors help prevent the patient from wandering outside, reducing the risk of getting lost or injured. Question 6. When assessing a patient with dementia, the nurse observes that the patient has difficulty recognizing family members and familiar objects. This condition is known as aphasia, apraxia, agnosia, amnesia. Pause the video and select your answer. If you chose option C, you are correct. Agnosia. Agnosia is the inability to recognize familiar objects, people, sounds, shapes, or smells, which is common in dementia. Question 7. The nurse is preparing a care plan for a patient with Alzheimer's disease who has developed sundowning. Which intervention would be most appropriate to include? Increase the patient's caffeine intake in the evening. Keep the environment brightly lit during the evening hours. Encourage daytime napping to reduce evening fatigue. Provide a quiet, calm environment in the evening. Pause the video and select your answer. If you chose option D, you are correct. Provide a quiet, calm environment in the evening. A quiet, calm environment helps reduce agitation and confusion that can worsen in the evening, known as sundowning. Question 8. A family member asks how to best communicate with their loved one who has moderate stage Alzheimer's disease. The nurse should recommend speaking in long, complex sentences, asking open ended questions, using simple, direct language, providing multiple choice for decisions. Pause the video and select your answer. If you chose option C, you are correct, using simple direct language. Simple direct language is easier for patients with Alzheimer's disease to understand and respond to. Question 9. Which of the following findings would suggest that a patient with Alzheimer's disease is experiencing early stage symptoms? Inability to perform basic activities of daily living, disorientation to time and place, severe memory loss and confusion, slight forgetfulness and difficulty finding words. Pause the video and select your answer. If you chose option D, you are correct. Slight forgetfulness and difficulty finding words. Early stage Alzheimer's disease typically presents with mild memory loss and difficulty finding words. Question 10. A nurse is educating a patient with early stage Alzheimer's disease and their family about home safety. Which suggestion is most appropriate? Store medications in a locked cabinet. Keep all rooms brightly lit at all times. Restrict the patient from participating in household tasks. Remove all mirrors from the house. Pause the video and select your answer. If you chose option A, you are correct. Store medications in a locked cabinet. Locking up medication prevents accidental overdose or misuse, which is crucial for safety. Click that subscribe button and join us next Monday.